It's really nice.
It is.
All right, we got a guest in the building, man.
Oh, yeah? Who you got?
Well, we got Lynn Cowles from Foundation Communities. It's some very interesting information on health coverage. And Lynn, let's see. Can you talk into that microphone and make sure? I got 18 microphone switches. So I got to make sure I get the right one. There you go. How you doing this morning?
I'm doing so well. It's so nice to be here with y'all. Thanks so much.
Thank you for being here. Now, this is going to be one of a few stops that you're going to be making with us this morning, right?
Oh, I feel sorry for her.
She's the one got to sit over there by you. I know. I feel sorry for her because she got to deal with yourself.
Some extra pay. So again, back to the Army, Lynn. If you are in a austere environment or a dangerous environment, you get hazard duty pay. I think you should renegotiate.
Right.
Go back and tell them, did you guys know what you were getting me into? So you may renegotiate.
Yeah, I'll go back to the policy day. I'll go see what they do for hazard pay. Yeah.
Yeah, you're gonna need a hazard pay dealing with thing 1 and thing 2 over here. It's gonna be an issue. It's gonna be an issue. All right. Well, tell us about Foundation Communities. Very interesting information.
Yeah, definitely. Thank you for having me. I'm so happy to be here and to be sharing info with KAZ audiences. Foundation Communities is kind of primarily known as an affordable housing nonprofit organization. We've got over 20 residences around the Travis County area, and I think a couple in North Texas, also in Dallas County, that provide affordable rents for people with low or fixed incomes. Sure. And so if you drive around Austin, sometimes you'll see like an apartment building that has like a big yellow sunburst outside. That's most likely a Foundation Communities property. Each property has a really unique community and really wonderful property managers and residents there who work together to help make sure that people there are healthy and successful and happy. And so that's kind of like one of the biggest programs at Foundation Communities and one of the most visible around town. But we also have what are called Prosper Centers, one in North Austin and one in South Austin, and in those two Prosper Centers, we have Prosper programs that are available to our residents who live in our Foundation Communities properties, but also to community members at large. And so anybody in Central Texas, and some of our programs operate over the phone, especially in the case of our health coverage program, anybody in Texas can call in and get access to free expert guidance connected to financial wellness, college and career guidance, tax help for people who need some help filing their taxes. And then the program that we're focusing on right now is our health coverage program, Prosper Health Coverage. Yeah. And that's because right now is the open enrollment period for federally subsidized health insurance plans for adults and for children also, depending on their family incomes, but mostly for adults who don't have health insurance from their employers. So it's a really important period, and we're trying to get the word out to make sure that all of right now it's like almost 11% of insurable people in Travis County don't have health insurance. So that's like over 150,000 people just in Travis County. So that's not including like surrounding counties or anything. But and so it's a big number of people. We're trying to get the word out and make sure that folks know if you don't have health insurance from your employer, then give us a call. We can help you see what your other options are.
Very cool. Now, we've got a number here real quick, 512-381-4520. That's 512-381-4520. You can also go online to prosperhealthcoverage.org. Some pretty interesting stats. At 18% uninsured Black working age adults in Texas have a much higher chance of being uninsured than white community members. As well, you guys also offer financial coaching, tax help, and college career guidance programs. Very interesting. Tell us about that.
Yeah. So our financial wellness program, they have two different kind of like tiers of what they do. One is one-on-one coaching with community members to help them meet their financial goals. So whether it's saving money to buy a house, getting out of credit card debt, dealing with student loan debt, figuring out how to start a small business, right? Like whatever somebody's kind of finance-related questions are, our financial coaches can meet with them for an hour, no cost. People can go back as many times as they want and deal with whatever their financial issues are. They also have a Fresh Start loan program so that people who are stuck in predatory payday loan cycles can actually get a loan from an established bank to pay off their payday loan, and then they can pay back that bank on usually a slower rate with a more affordable interest rate. So
that's gold right there.
Yeah.
There are so many people that are just caught.
Totally.
And Yeah. You got me there. I mean, she already was reeling me in, but that in itself, if we can get those people out of, and I like what you said. I don't think I had that verbiage, predatory. Man, that's great.
Yeah. And it's, it's big, and people, they need a loan for a car payment, right? And so, and it's predatory because as soon as people get stuck with that one payday loan, then they take out another to pay for that one, right? And it's because they're easy to get. The interest rates are so high. They have there's no credit check or anything, so it's just like it's very, in the short term, it looks attractive, but in the long term, it leads people to financial devastation in some cases. Yeah.
Yeah. You end up spending more time paying off and spending more money on a loan that's it just inflates, and it's absolutely crazy, especially when there's a certain interest rate. I got caught up in that once, and it was not pretty because it was a very small loan, but I mean the interest rate was double digits. Yeah, and that's really, really hard to deal with because you're like, man, I want to pay this down.
Right, and I feel like it just keeps growing somehow. You know, yeah. And then the other thing that our financial wellness program does is they have classes where people can come learn some of the sort of like entry-level finance skills. So why to open up and use a checking or a savings account, or how to make a household budget. So some of those kind of like before you get on the path to meeting maybe like more complex financial goals, the sort of like the financial stability ones, so that people can develop those household budgets and maybe save a little bit of money so that they can then have a nest egg to buy a house or start a business or whatever their financial goals are. And all of our Prosper programs are really like, we used to be called community financial centers before we were called Prosper centers. And because even in the case of our health coverage program, the health coverage program recognizes that in order for people to have good health, people generally have to have some kind of paying organization like Medicaid or a health insurance plan or some office, right, to help them pay for the cost of their health care. Yeah. And that's because if people don't have that office, if they have a medical emergency, if they have an injury or anything, a chronic medical condition that comes up, then medical debt is still the leading cause of bankruptcy in the United States. Right. And so having health insurance is also a financial necessity if people want to make sure that they can avoid medical debt.
One of the first things when I came off of active duty, Lynn, I had 3 kids, didn't pay a dime for them. Yeah. And growing up, I'm a military kid, so my dad always reminded me every time I got in trouble, hey, I had you for free, right? Nice. So when I see my friends who have hard births, when they're paying tens of thousands of dollars to have children, it blows my mind. I remember I'd left active duty and I took a Fortune 500 company job, and I remember my first check when I saw that, I was like, wait, what? Like, you guys I actually have to pay for this, for this healthcare? So that leads me to this question. I know the answer, but I want our listeners, so bear with me. Don't lower your opinion of me like you already have of Jabari.
Never.
Why do people not have health insurance? Because it seems like it would just be something that you should have. So why do people not have it? I feel like there are reasons. Can you help me understand that?
Yes. Oftentimes when people don't have health insurance, they're caught in what the public health community calls gaps. So in the United States, we don't have one health program for everybody. So it's not like once you're born, you qualify for some kind of like a program where the local government or the state government or the federal government will help you pay for your health costs. And that exists in most industrialized nations across the country, not in the United States. So in the United States, we have most people who have some kind of health insurance have it from their employer. It's like over 50% still. So people who work for businesses that have over 50 employees, the IRS requires those employers to offer people health insurance, and that's how people have coverage. But then there's the other 50% of people who don't have a job that gives them health insurance. And so for those people, there are other kinds of programs. There's Medicaid for children who are under 18, the Children's Health Insurance Plan for children who are under 18, who maybe their families make a little bit more money, then qualifies them for Medicaid. And then there's programs like TRICARE, like for veterans and for active duty folks. And then we have also there's Medicare for people who are over 65 or who have have certain medical conditions. So there's all kinds of different stuff out there that can help people get coverage for affordable costs.
Yes.
But then there's like still the, 30% of the population who doesn't qualify for one of those programs. And we're talking about millions and millions of people here, and who doesn't have an offer from their employer. And so before 2010, when the Obama administration passed the Affordable Care Act,
yes.
for people who were self-employed, people were unemployed, for people who had work for small businesses,
yes.
or for folks who maybe collected incomes from a collection of part-time jobs.
Yes.
For people who in those situations, there just wasn't anything. We just didn't have anything before 2014, which is when the Affordable Care Act, or the Obama administration health policy, turned things around and made health plans, qualified health plans, available for folks. And so, but still now in 2023, going into 2024 coverage years, many people don't know how to apply for those health plans. They don't know how much they're going to pay for them. They don't know whether or not those plans are going to cover their doctors. And so one issue is just that we don't have a robust kind of like public knowledge or any kind of like long-standing education campaign to let people know that these programs exist. And so our outreach team will go into communities sometimes, and they'll be like, oh, I don't have a job that offers me health insurance. What else is there for me? I'm too old for Medicaid. And it's like, oh no, we have a program for this, but people don't know about it. Oh. And then also, for some people who have offers of employer coverage, it's just too expensive,
Yeah.
And so you
don't want anybody touching that check before you get it.
Right.
All this is coming out, and you're like, wait, hold on.
Right.
I thought I was expecting this amount to come in.
Yeah.
And those are the decisions. I think that's when people are making those decisions and realizing,
yeah,
I'll be all right. I'm 24. I'm 26. I'm normally in good health. I'm good.
Mm-hmm.
I didn't even get the COVID.
Exactly. Yeah, I didn't get the COVID, so I'm gonna be all right.
There's like nobody left who didn't get COVID, right?
Exactly. So as far as coverage, there's different extensions of coverage. There's could be a sore throat, it could be a dental issue, or it could be more extensive. How do you guys deal with that?
Yeah. So we get to know our clients really well. So most of our enrollment appointments last around an hour or an hour and a half, and we learn from our clients what their health needs are, what their concerns are, what their kind of personal relationship to risk prevention is. Some people will pay a little bit more per month to have a plan that has a lower deductible, or that where it costs less to see a doctor. And other people, and honestly young people usually, they'll be like, no, I want to pay as little as possible per month. This plan is just going to be for emergencies, like in case I get hit by a bus or something, And so we learn all of those different things about our clients. And then also, like, over the course of the year, we continue learning about our clients, because they come back in and they say like, oh, it turns out I need to see a dermatologist, but I'm not really sure how to navigate this list of doctors that my plan covers. So how do I pick one, Yeah. Or like, I have 3 medications now and I'm not sure how much I have to pay for each of them. So we help people with medication management, or if somebody needs to plan a surgery. So that's all a long way of saying, by getting to know the people who come into our office and who work with our navigators, we really learn like what their priorities are and how they want to use health insurance, because some people with high medical needs will need a much different plan than somebody, again, who's like, 24 years old and getting a health insurance plan for the first time, and is really just looking for like catastrophic injury prevention, or prevention from medical debt connected to catastrophic injuries. Yeah.
I was just kind of curious. What if are there some educational opportunities? So we're making fun of the 24-year-olds. So it's my first job.
We love 24.
Yeah, it's my first job. I think I'm invincible, but maybe I want to learn more, because I'm hearing stuff like flexible spending programs, plans. I don't know what all this stuff is.
Yeah.
Can we come in and get maybe a little education, just kind of an understanding from people? Because it sounds like these are subject matter experts who have been talking healthcare programs for years.
Yeah.
Is that an option?
100%, yes.
Okay.
And so we want to be open to anybody who needs any kind of guidance or advice, or any question that folks have, or honestly, like any feedback that people have about their experiences with health systems. Like, we want to hear about those things, and we want to make sure that our public health community is accountable to the experiences that people have, whether they're unable to find a dental program that works for them, whether they went into the doctor's office for a preventive care visit that was supposed to be free, and then their doctor's office charged them $15 for it or something. Like for preventive care on any plan that people enroll in through the website is healthcare.gov. That's the federal health insurance marketplace. Preventive care is totally free. So if anybody gets in a plan that has, even like if it has an $8,000 deductible or if it has a $0 deductible, that plan has free preventive care. So if somebody goes to their doctor's office for a free physical and the doctor's office says your copay is $10, then and honestly, sometimes patients don't feel comfortable being like, well, my health insurance documents say that it's free, and so I'm not really sure. And so in those cases, it's helpful for people to talk with a navigator, even like preemptively, to say like, I'm going to go have this appointment. What's going to happen? What should I pay? What are the questions that I should ask my doctor? So not only like the general health insurance terms can we help people figure out, like, what the heck is a deductible? Yeah. What is coinsurance, right? What's a provider directory? All those things. So we want to help make sure that we can also like set people up for success before they go to the doctor. So what kinds of questions should I ask my cardiologist? Yeah. Or if I'm seeking out mental health care, what's the process for finding an appropriate mental health care professional, like a counselor, who's going to like mesh with my personality? Mm-hmm. So there's all kinds of things that we can do to help people, like, identify the right doctor, or do some research in advance, or just, literally send people away with a list of questions to ask.
512-836-2887 if you want to call in and talk to Lynn Cowles. Lynn, I got to ask the question. Mm-hmm. For my 24-year-old homies that are out there, they're streaming us. They're not on terrestrial radio.
Yes, they are.
They're streaming us right now. I know y'all are out there. Lynn Cowles, mm-hmm. Why is healthcare so expensive even with insurance?
Yeah.
They want to know that. I know they want to know that.
Yeah, no, that's a totally fair question. And the short answer is because healthcare is expensive. And that's not helpful to anybody. Healthcare is expensive for like many, many reasons that we could go into later. And partly healthcare is expensive because there are so many people who are uninsured. So when uninsured people go to the hospital and then they can't pay for their, $30,000 appendectomy, then the hospital system and usually the taxpayer ends up footing that bill. And when the taxpayer foots the bill, then the insurance company later on has to increase their rates because the hospital charges them more. So the whole system is based on the fact that in the United States we don't have a universal healthcare system for people, because if we did, a universal healthcare system would require the federal government to help pay for people who didn't have health insurance, and costs for everybody else would go down. Now that said, that's at like a very kind of like broad level.
Oh yeah.
For individuals who have a health plan, health insurance is expensive because employers can only pay for part of it. Maybe the employer doesn't have quite enough capital to pay for a big chunk of their employee's health insurance, right? Or the plans that the employee picked to help their employer, the plans that the employer picked to help their employee get coverage. Those plans have higher deductibles because they cost less for the employer to purchase, right? But in general, it's healthcare in the United States is and I don't say this in like a snarky or like a glib way, but it's broken.
Yeah,
and so,
because
of that, it's really important for people to talk to local advocates who are experts to find out what the best options are for them. So even if people do have an offer of health insurance from their employer, if it's too expensive by a very specific standard that the federal government sets every year, if it's too expensive, then people might actually qualify for financial help to purchase the plan from the health insurance marketplace where people go if they don't have employer coverage.
Right.
And the IRS helps people pay for their health insurance also based on a sliding scale. So people who have lower incomes tend to get more financial help to help them pay for their monthly premiums through healthcare.gov or through the marketplace. Yeah.
Sounds good.
Okay.
Yeah.
Sounds good. Well, Lynn, can you hang out with us for a little bit longer?
Yeah.
Okay, cool. Sounds good. Lynn Cowles is in the building. Foundation Communities is the place you want to check out. Phone number is 512-381-4520. Website, prosperhealthcoverage.org. And, of course, you can always call us up here at KZI 88.7 FM at 512-836-2887 and get on a question with Lynn. We'll take a little break and come back. This is The Morning Grind.
Morning.
88.7 FM KAZI. Oh, I love that jam for Burna Boy, man. That is hot. That is blazing, son.
Yeah, that's a good one.
That's good stuff, man. Burna Boy. Also, the recent Hall of Fame inductee, Miss Chaka Khan, who is definitely worthy of that.
For sure.
Yeah, man.
That's kind of late.
Mad late.
I hate to complain.
Mad late.
But yeah.
Mad late. So.
Shaka is a jewel.
Yes, she is.
I'm gonna tell you, she also still looks amazing.
Yeah, she does.
I mean,
she does.
Whatever her age is, I don't even want to look it up. I could do a little math in my head here.
Just a little bit of math.
She still looks great because she's still performing, isn't she?
Yo, yeah, most definitely.
I thought I saw some pictures and stuff like her on stage, and I'm like, wow, she's vibrant. She's still out there. So.
She is. And I just found out recently, I think probably maybe a couple of years ago, that Shaka Khan played drums.
What?
Drums, dude, like drums,
skills.
like back in the mad skills, like back in the 70s, right? She was a drummer, and I think she evolved. I mean, she could always sing, but I think she was just kind of the consummate musician, right? She could sing.
Isn't that just? Well, maybe it's just me. Isn't that just something that you would just hate, that a person could be such a great drummer and they're an amazing singer at the same time?
And
they have the skill set to do it at the same time.
Same time, son.
Yeah.
Oh my goodness. All right, so real quick, 8:35 here on 88.7 KAZI. Shout out to DJ Wiz is on the check-in. Don't forget to check him out on Tuesdays from 7 to 10 with the Latin Freestyle. An amazing show. Really, really cool. So DJ Wiz, also shout out to Miss Wiz as well. What's going on, Miss Wiz? How you doing? Also, I just got a text from my daughter's mother who's also a Zumba instructor as well. Oh. And she was telling me she used to teach Zumba for Foundation Communities. Yeah, really cool stuff. And she says Foundation Communities is a great organization. Awesome. So you're getting some love here, Lynn. That's for sure.
I love it. Yeah. I was looking at your Instagram before we started today, and I saw the Zumba photos, and I was thinking about our Zumba instructors, and I was like, oh man, I wonder if you've ever like crossed paths with any of them, but you definitely have.
Oh, I crossed paths with this one.
Lynn, I gotta know though. Do you have the skills to pay the bills? Can
I Zumba? I love Zumba. Okay, I will totally go do our Zumba classes. Okay. Yeah, and a little shout out. They cost nothing. Also, people can join our Zumba classes online. They can join in person. Yeah.
Oh, that is so cool.
Yeah. Our health initiatives team operates the Zumba classes. They do food pantries and health screenings and whatnot at all of our properties. And so, but they're open to the community as well. Yeah.
That is absolutely amazing. Absolutely. Okay. So Lynn, if I'm someone who's sitting at home and I don't have healthcare coverage and I'm feeling a little weird about contacting you guys and going in or talking to you on the phone, tell me how I can feel better about the experience of calling you guys or dropping by or going online. Just kind of give me that warm blanket. Yeah,
that's such a good point, because health questions and health issues can be so scary, right? Like even thinking about the cost of a doctor's visit for people who don't have a health insurance plan or maybe any kind of program that they're part of, like Medicaid, or in Travis County, we have local programs like MAP, the Medical Access Program. But if somebody doesn't have access to one of those, it can be one of those moments where you feel like you need to go, you need to go get the thing checked out, but instead of moving forward, you kind of move in reverse, and you sort of circle in, or find yourself feeling even more stifled than you were before. So I think the first thing to know is that we are like a wonderfully friendly bunch. We really just want to chat with people to see what their options are. We don't sell anything to anybody. We have no incentive to get people into a health plan other than for their own health and for their own financial security. And as much as I understand the complexities of the American health system and the failings of it, like earlier I said, it's broken, and in many ways it is. But the good thing is that there are local advocates to help people make the system work for them. And so there's that sense of okay, well, if I just know which boxes to check, if I just know who to talk to, I can learn how to do this, right? Like I can learn how to make this system that does have its flaws, that does have its failings, work for me. Yeah. And oftentimes the only thing that folks need to do is just make that one phone call or drop by one of our Prosper centers and just say, you know what, I'm here, and oftentimes we have some coffee, there's some snacks, people can just come in and say I have a couple of hours, I don't have an appointment, but I'm here to just talk with a health navigator and just say this is where I'm at right now. This is my health history, or, and we don't have to get into medical details or anything, but some people want to. And so our accessibility makes us available to anyone in any state. If people can't leave their homes, they can give us a call. They can, like if people are out and about, they can just drop by or make an appointment. And so the good thing is that the public health system does have these little pockets of comfort and hope.
Yeah.
And it can be a place like the Black Men's Health Clinic. It can be a place like Foundation Communities, but offices that are really meant to be there to just be supportive, and to help people access this system that, granted, is complicated, but to do it with like a guiding hand. Mm-hmm. And that guiding hand, once you see a health navigator, sometimes 3 times or 4 times, people are oftentimes like, oh, cool, I know how to do this on my own now. I don't need you guys anymore. Mm-hmm. I'll come back and say hi. I'll bring some donuts. I'll bring some coffee or whatever. But then also, some people just want to continue seeing us, and that is totally cool too.
Yeah.
Folks, if folks want a guiding hand throughout their entire health journey, we can be there to be like, okay, this is the copay that you're going to pay when you go see this doctor. This is what this doctor's specialty is. Here's a list of questions that you should know the answer to when you leave there, and here's how you can follow up with them afterwards. So, yeah.
You got one?
I think we got a caller. Good morning, caller. How you doing?
Yeah, good morning. How y'all doing? It's T-Bone T. How y'all doing?
What's good, T? How you doing, man?
He's a long-time caller, Lynn.
Yeah, he's a long-time caller, yeah.
Yeah, I have a question. And, y'all have something to do with housing, right, ma'am?
Yeah, Foundation Communities does have affordable housing residences.
Okay, I like to bring something up, because I always hear the mayor on TV be talking about getting everybody off the street.
Mm-hmm.
Now, what about people that don't have a job and can't work? Do y'all have anything to do with that? Try to get people off the street?
Yeah, so we have a couple of different kind of wings of our housing program. One of them is for people who are single adults, and one of those, the other wing is for people who are members of families with children. And so, if somebody is living on the streets right now, if they've been without a home or without a house for a long time, or even if that's recent, then we definitely recommend that folks call in and see where they can get on our wait list for one of our affordable housing locations. So there's that wait list option, and honestly, I don't know right now exactly how long the wait list takes, but it's definitely a good idea for folks to get on it. And then also to keep in touch with our housing navigators, because if your phone number changes or if your email changes, then you'll want to make sure that our housing navigators know that, so that when they call you, because the wait list is because you're up at the top of it, you want to make sure that you get that phone call. And so, so there's the wait list option. And then we also have a children's home initiative. And so if people are even at risk of experiencing homelessness, so if people are living on the streets right now, or if they might because they're facing eviction, then those folks can, especially if they have children who are under 18 years old, the what do you call it? The priority or the focus of this program is to make sure that kids don't experience homelessness, because there's so many health and developmental and social issues and problems that come from that experience when kids are young or when they're under 18 years old, that the Children's Home Initiative primarily works to fast track people through our housing system to make sure that kids don't experience homelessness. So there's a couple of different ways that people can get access to our affordable housing. There's the wait list for single residences, and then we have those family properties also, and then separately from those family properties, the Children's Home Initiative. Does that answer your question, T-Bone?
Yeah.
Okay.
What about the seniors? What about the senior citizens?
Yeah. So senior citizens would be either in the family category if they had a spouse, or in the single resident category if they didn't have a spouse.
So there's no discrimination on age.
Right.
Yeah. That's
Ageism.
great.
Yeah.
That's a good question,
exactly.
T-Bone.
Yeah, definitely.
Okay. Now, what about the people that can't work?
Mm-hmm.
Now, what about them? Do y'all still assist them if they can't work?
Yeah, definitely. And so often if people can't work, then there are other programs, maybe like Social Security disability insurance if people can't work because of a disability, or supplemental security income if people are older and not working and also have low income. So there's lots of different programs out there that can help people have some kind of income, even if they're not working. And so our housing navigators also our Children's Home Initiative navigators actually have 2 years of wraparound kind of like support services to work with folks who are going through that initiative. But then also all of our single residence units have social workers who work in them also, who can help people get connected to those different kinds of programs. So hopefully, you know, it doesn't happen all the time, but hopefully nobody doesn't have any income at all. And we've got those kind of like assistance programs to make sure that people can get connected.
Okay, now what is that telephone number again?
I got it right here.
Okay.
You ready?
Yeah.
Yeah.
All right. 512-381-4520.
Okay, 4520.
Yeah.
Okay.
512-381-4520, T.
Okay, because, man, y'all said so fast, you know. I mean, if y'all slow down a little bit and you said a little bit slower.
Hey, man, I ain't talking too fast. You just thinking too slow.
Yeah.
You just listening too slow, man. Must be all the referees under his ear. That's
I'm
what
in
it is.
slow motion. I can't keep up. Man, I'm Speedy Gonzalez over here.
Hey, y'all have a good morning. Douglas, I had a question to ask you, but it's about sports, but I'll talk to you another day.
Hey, wait, hold on. Lynn is quite the sports fan here. We were talking some volleyball. Let me see if Jabari's game. Jabari, you want to
y'all go. I'm gonna give y'all 5 minutes and 22 seconds.
Okay.
That's a lot. That's a lot of time. We might be able to
It is a lot of time.
Yeah, that's good.
What you got, T-Bone?
But I wanted to ask you, did you see that Grambling and Southern game?
Did I? I'm a fan of the classic. So Grambling and Southern.
Yeah, me too.
It's been going on for 50 years.
Oh.
And going into this weekend, it was 25-24. So quite the rivalry.
Oh my gosh,
Because sometimes you hear, it's a rivalry, but it's one-sided. The whole city of New Orleans supports this football game between the two. It's if you haven't been to New Orleans, it's a walkable town, so you can walk from your hotel to the stadium, back to your hotel, and it is friendly. So whether you're wearing Grambling colors or Southern colors, you can go to any tailgate. I walked past tailgates, and I thought we were rivals. Bitter rivals, and I see Grambling and Southern jerseys hanging out,
just hugging,
breaking bread together.
Yep.
No, people, you're supposed to hate each other. What a great time! There's a step show. The bands are amazing.
Oh, cool.
Yeah, Tebow.
And I want
step shows.
I want to say, if you don't like the football game, please watch the halftime show.
Yes, sir.
Cool.
Yes.
Everybody go to see the halftime show, and then a lot of people leave, you know.
Yes, the halftime show is is the show.
The halftime show is scheduled, and then they play a football game around the halftime show.
And the football better not get in the way.
Thank you.
Yeah. But man, I'm gonna tell you, I love it. I love that halftime show and see them little young ladies be dancing, and the drum mates be backing off, spinning off backwards, you know. I say, God, no, man. I said, man, you gonna break your back, man. God, damn.
Yeah, that is the exact. Those are the people we're talking about.
Yeah.
Those are the 22-year-olds who don't need the health care.
Who need the health care coverage.
Pull that stuff off. But hopefully they're listening to us here so that when they get out of college and they get to these jobs, they can make some informed decisions. So we can wrap that all back up in there. But yes, sir, it's quite the show. I'm trying to get people to go. And the people of New Orleans, Lynn, I told the story last week. I went into a barbershop. A guy was in the chair getting ready to go next, and he knew I was an out-of-towner, and he let me go first. And all the guys in there just want to talk to me and just kind of find out where I was from and just like welcome me to their town and tell me places where I need to go eat. I'm like, guys, I'm only here for a couple more days. I need another
16
month.
places to go. Yeah.
But thank you. And then of course, if you want the vignettes, if you want to try those, you got it. Yeah, it's you got to go to New Orleans. Trolley car. You got to go.
The Cafe Du Monde.
Hey,
she knows.
Hey, you got to go to New Orleans and eat some of that food because you're gonna want to go back.
Yeah. Well, now I want to go to that football game.
Oh, it's a show.
The halftime show. Sorry.
Oh yeah. And I want to say one more thing. That coach for Grambling, he don't know how to coach.
Wait a minute.
I knew that was coming.
He don't know how to coach, man.
Here we go.
You know what? That's why they fired him from the NFL, because in the NFL, he didn't know how to coach. You know. But hey, man, y'all have a good morning.
Good morning,
Thanks,
T-Bone.
T-Bone.
Take care, man.
T-Bone,
Peace to
he's
you.
dumping on the guy. He already fell from grace in the NFL, ended back in college. He's funny though. That's a great opportunity to kind of talk about something else. Mm-hmm. So the 22-year-olds that could still, and what T-Bone is referring to is some of the drum majors. Mm-hmm. They will in their performance. They will bend backwards and go all the way. Now they're wearing a cap, maybe like a chimney cap, a stovepipe cap, but they'll go all the way back until the top of their cap will go to the ground, and then they'll come all the way back up.
Oh,
That's
wow.
quite the back bend.
Yeah.
But Lynn, what happens if I never go to the doctor? I hear you seem like a nice lady. You're up here and you're talking to Dapper D and Jabari, and it's going good, but I'll never go to the doctor. Like, why am I don't feel like I understand why I need to go to the doctor.
Right.
Can you help that person understand why they need to pay attention to this Lynn Cowles that's talking to us?
Yeah, absolutely. The reason that people should go to the doctor and also just like once a year, is because the medical conditions that we develop over time, whether it's maybe like a lower back issue for somebody who's bending all the way backwards pretty often, or maybe even like a spinal issue, or for people who are just living their lives and are, depending on where they live, what they're eating, like what their genetics are, we don't know what happens in our bodies until something manifests itself with a symptom, right? And so what preventive care does is it allows people, again, totally at no cost to them, if people get into a health plan that is qualified, and we can talk about what that word means, but if somebody gets into a good, affordable health insurance plan, then the federal government, through the Obama administration's Affordable Care Act, requires that plan offer them free preventive care. So it's a free physical every year. For women, it's an annual well-woman visit, free blood pressure checks, cholesterol checks, tobacco cessation classes, nutrition counseling, depression screenings. All of this is fully free on every health insurance plan through the federal health insurance marketplace, and now required through most employer plans too. But a lot of people don't know it. Mm-hmm. And so if people don't go get that physical every year, maybe their kidney is showing, like if they did get a kidney blood test, then that it would show some kind of like imbalance in their kidney functioning, and people would know that in advance. And medical conditions are always 100% of the time more affordable to treat early than to treat later down the road. Mm-hmm. So there's that issue, right? That like medical conditions grow slowly inside of our bodies and we don't know it. So for those things that could be chronic or that could be expensive because they develop over time, and I don't even like saying this because I don't want to feel like you're jinxing somebody. I'm trying to knock on wood here, but if somebody has
Jabari's
a cancer diagnosis,
Man, you know what? Don't start with me. Do not start with me, son.
I'm knocking on my head. Yeah.
I was trying to help her out. She's a guest.
Right.
Please continue, Lynn.
But like a cancer diagnosis, for instance, people don't know that they have cancer until they're in stage 4, and it's devastating for families. And so these health plans are meant to prevent those situations, to prevent families from tragedy, to prevent families from major medical debt, which is its own tragedy. And then, of course, there's also and this is what we end up telling usually most 22 or 23 years olds, the average appendectomy is going to cost you $23,000 to $30,000.
Wow.
And people get appendicitis out of nowhere, and it happens when you're 21, it happens when you're 41, it happens whenever it happens. And that's just the one thing that happens. Sometimes it's a freak thing in people's medical histories or medical pasts. And they're like, oh man, I wish I would have had health insurance for that one, because no matter what plan somebody gets into, it will have an out-of-pocket maximum connected to it. So it'll have a maximum amount of money that people pay at any hospital in the United States. If they have a life-threatening emergency or illness that pops up, then the health law also requires that hospital is technically in network, even if that hospital is in Florida or Idaho or Michigan or wherever. If somebody has a health plan in Texas, but they have an emergency anywhere else in the United States, then their health plan has to cover them for that emergency until they're stable, And so even if people are visiting family or whatever, if they have that appendicitis, if it pops up and people need to go to the hospital, it can be tens of thousands of dollars. But if folks have a health plan, they're protected by that maximum limit.
Well, Mr. Warfield is rich.
Yes,
I'm starting to feel something. I won't be in next Wednesday, Jabari. I got an appendectomy that's got to happen. Can I get
It
about
doesn't happen like that.
You got a brain endectomy that needs to happen over there, man.
I just thought that was okay. So I know we don't have much longer. Sometimes a person may be reluctant and reluctant to seek medical care, and even when it's routine, because you said preventative, and I appreciate that. But that's out of the fear that I'll be told something's wrong. Because you got me walking up in there, Lynn, and these doctors are just foaming at the mouth, and they ready to give me all this bad news.
Yeah.
So could you help someone that's reluctant, that is hesitant to find out?
Yes, and usually it starts with a conversation. So if talking to one of our health navigators is not the same as going to a doctor's office. Yes, doctor's offices can definitely be scary. They can be overwhelming. Sometimes they can be busy. People, if you haven't been to a doctor's office in a long time, you can feel vulnerable there, or even just like, the stress is heightened, maybe anxiety is up a little bit. But so usually a really good place to start is just by talking with a friendly navigator. Okay. So like take little steps to get to the doctor's office. Don't go full on like I'm gonna go to a walk-in clinic right now and ask for preventive care if you haven't done it in 20 years or 10 years or 5 or whatever. But so oftentimes just talking with one of our health navigators can give people just a little bit of information to digest, take home with them, think about, and then come back. Whether it's come back to your navigator and say like, okay, you know what? We talked a little bit about what kinds of programs I can get into. Now maybe let's fill out an application, right? Now maybe let's take the next step. And then after somebody fills out an application, maybe they want to pick a health plan right then. There are many health plans to pick from. For Travis County residents, Williamson County residents, it changes based on where people live, how many plans they have access to. Yeah. But either way, that process can be its own kind of information moment, or it can be daunting too. So just taking those small steps though, and then maybe by step 3 or 4, you're like, all right, you know what? I've been talking about my health for a little bit now with an expert. I feel kind of more comfortable about it. I think I'm ready to go to the doctor. I think I'm ready to go check out that free preventive care. And so we advise people not to just dive in wholeheartedly if it's been a long time, but rather just take little steps and feel comfortable with one step before you take the next one.
I like the sound of that.
Cowles in here. Look, she's been breaking it down.
Yes.
If you were apprehensive, if you're not, if your last name isn't Warfield and you don't live at the Warfield Mansion, and you don't just walk, Jabari walks into the doctor's office and he's got one of those stainless steel attaché cases, and when he's done with the doctor, he just opens it up and takes out a band of money and hands it over. But
and then hands them to everybody else.
We don't do that. But for the rest of us, you have helped us out. This was great.
The views and opinions expressed by this fool to my right are not necessarily mine. No, this is good. Yeah, this was good. This is a great thing. I think we got a lot of great information.
Cool.
So thank you so much. I really, really, really appreciate you coming through.
Yeah. And, can I close out with just a couple of deadlines?
Yes,
okay.
Please.
So for people who don't have insurance from their employers right now, or even if you do and you feel like it's too expensive, then the time when anybody who can get into a health insurance plan through the health insurance marketplace runs through January 16th of 2024. So that's the deadline for most people to get into plans. If people need coverage that starts January 1st because they have some kind of medical condition, or they just want a plan that lasts all of 2024, the deadline for most people is December 15th. Now, some people qualify for enrollment throughout the year, so even if you're listening to this and you mean to mark it down and you forget, we're open year round. We want to talk to people about their health and their access to healthcare and how to improve their health throughout the year. So those deadlines, though, are important. So January 16th is when the open enrollment period closes. December 15th for most people is the deadline for them to have a January 1st coverage start date. So those dates are coming. Those deadlines are coming up around the corner. So just for everybody to know. But then again, if you miss those deadlines, come talk to us anyways. We're here to help, and many people can enroll throughout the year as well.
That's a beautiful thing.
Yeah.
That is a beautiful thing. So information real quick one more time. Grab a piece of paper or whatever you're writing down with. Phone number for Foundation Communities is 512-381-4520. I'm going to say it one more time slowly for T-Bone T. 512-381-4520. T-Bone T's taken care of. Online, Prosper Health Coverage.org is the website. Lynn, thank you very much for this. This was wonderful.
Yeah, it's been such a pleasure. Thanks so much, y'all.
Sure, no
He's
problem.
out here writing down with a rock and a chisel. Taking him so long to write stuff down.
A piece of chalk on the sidewalk is what he's writing with now.
I hope he got it that time.
I hope so too. No, he'll probably blame that one on the refs too.
Yes, he will.
This is KZIFM Austin. We'll be